those are some of the typical, the conditions that Chinese medicine can help. The chemotherapy, like I mentioned before. Yeah. So the earlier you incorporate, the better off. Yeah. And we have patients that already had a couple rounds of chemo, so they know exactly how they feel with the chemo. So round 3, they started with the herbs and acupuncture. It's like, oh, they feel nothing. It's like, oh, they don't feel like they're having the chemotherapy. Yeah. So that's exactly the ideal situation. If you do it right, and normally you don't feel. We encourage the patient to basically, only maybe take that day off, and still go back to work right after. So keep everything. Radiation, like I mentioned, it's considered the heat toxin. So there comes with a different set of side effects, and so herbs, acupuncture can help with that. Yeah. Surgery, like we talked about, the pre-op versus the post-op care. Yeah. So there are different things you can use, and the most common for like breast cancer, lymphedema. Yeah. So this is there's herbs, there's different ways. Even acupuncture we use, help to stimulate. Neuropathy. Yeah. Neuropathy, and we have a like herbal soak. Yeah. Because the problem is the peripheral nerve, and instead of taking Neurontin, all the block, nerve block from other, if anything local, you can use. So we have like a herbal soak. It's just soak it for 20 minutes, half hour, every night. Yeah, you can see a big improvement. Yeah. So that because it's a very local problem, you just need a local treatment. And tamoxifen side effects. Yeah, this is hot flash, night sweats, right? Like tamoxifen-induced menopause. Yeah. And the acupuncture. There's one doctor in Detroit, I think. She discovered, we use the one we call Splint 6. Yeah, 1 point. You can do needle. You can also do like acupressure. Yeah, so that point and help with the hot flash and night sweats. Yeah. So besides that, we have other approach, different set of combination, to help with that as well. Yeah. And because one of the side effects is people have the joint pain, right? Yeah, it's the same thing because you block the estrogen. The estrogen provides like a layer of moisture and lubricant. Yeah. So if you take that away, so that it becomes stiff. It's the pain. And instead of taking all the pain meds, so what normally we do local acupuncture, and also I have like a herbal patch we use. Just sleep with it, morning take it off. So that works very well. Yeah, so there's always a different way. So this is kind of like the point of my talk is like, okay, at least if there's a problem, there may be, besides the standard treatment, if it's not, if it's good, that's great. If it's not helping, there's other ways you may need to explore. Yeah, that's and depression. Yeah, depression is you're probably familiar with the term chemo brain. Yeah. So the chemo brain is the same thing. A lot of toxin inside the brain because of the treatment, and the brain is a very special place. They have what we call the BBB, like a gate. That when the body is at the emergency mode, they open up. So the toxin just takes a ride and get into the brain. So when that emergency is off, that gate shut off. So the toxins cannot be out. They're just trapped inside of the brain. That's literally what chemo brain is about. So from the acupuncture treatment, you stimulate, there's endorphins, there's dopamine. So hope the BBB will open again, you get the toxin out. Yeah, so that's just a different way. In conventional medicine, probably we don't have a way to address that part.